Welcome to the topic on HCC TV. I'm Todd Duplantis. If you're watching us on the cable channel, make sure you jump on over to social media. Follow us on Facebook. You can find us on your Houston Community College District. You can find us on Facebook, on Twitter, on Instagram, all social media platforms, including YouTube, where you can subscribe to our YouTube channel, Houston Community College District. Subscribe to it and you'll get notifications when these shows are posted. If you're into podcasts, you can download the audio versions of all of our shows at hccs.edu/podcast. This is a show, of course, where we highlight Houston Community College, our students, our programs, and our reach into the community. We're going to talk about how COVID has changed all of our lives. You know, the COVID pandemic has really highlighted the importance of medical professionals, and HCC has been in the forefront of training the next medical professionals through our Coleman College of Health Sciences. What does it look like for our students now as they're training in this new world? And what is it going to look like when this COVID thing starts to go away? Will it be the same? We're going to find out more. Dr. Phillip Nicotera, president of Coleman College of Health Sciences, joins us right now to answer some of those questions. Dr. Nicotera, thanks for being here. Well, it's good to see you. I want to ask you first off, we talked about this before. Maybe you can bring the viewers, though, up to speed at how Coleman met the challenges of keeping our students in the classroom, even if it was virtually, but at the same time, trying to keep them safe from COVID.
Thank you, Todd. It was quite a task for us to get us back into the classroom. And we're very fortunate that we had some faculty and our staff was willing to take on that challenge. So last August, we came back into the classroom. And so the first thing we needed to do was to put a lot of our material online. So we ran our classes online. And then our next step was to be able to get students into the classroom, into the laboratories. And so in August, we were able to do that. And so it's very important in healthcare that we have hands-on experiences. And so we brought our students in a very safe manner, following COVID regulations, to get back into the lab. And we did that in small groups, and then we were able to expand that as we got better at doing that. And then by getting the hands-on experience, our next step was to begin simulation. So we have a very, very high-end simulation center on the 10th floor in our building. And so we were able to get students back into simulation and create scenarios that were very, very close to what they would see in a real hospital environment.
I know in a hospital environment, the sterilization is the key to keeping everything as clean as possible. Right. And that was before COVID. Does it look a lot different now? I mean, you guys were wearing face masks, or most of your students were in face masks before. What does it look like now in this new world?
I think it's, a heightened awareness of being, we'll call it more sterile, but being more protective of ourselves as a healthcare provider. So, we always were sterile, but that heightened awareness in wearing face masks when we normally would not wear them. I mean, in the past, in many cases, we would not wear masks, but now we're wearing them all the time. And probably we're washing more and taking more precautions as we go in. I think as in any profession, sometimes we become a little bit lax in the way that we do things, and we're comfortable. But COVID has really changed the way that we do those types of things.
And now that the vaccines are rolling out, has that changed the way instruction will go for the summer and the fall?
I don't think it really has, at least for the summer and for the fall. We're encouraging everyone to get vaccinated. I think that, without a doubt, is a very important part of this, is getting vaccinated. It is, the vaccination itself is giving us some sense of security in increasing the number of students that we can bring back on campus. But there are a number of other factors that play into that. And that is, everything is declining. Hospitalizations, infection rates, and deaths are declining. So that, along with vaccination, has made us more comfortable at coming back into campus.
I know early on in this, you and I were talking, and one of the dilemmas you faced were, it's so essential to get your students into the hospital and professional settings to practice their work, but the healthcare providers didn't necessarily want the students right away because of liability reasons. How is that looking now? Has that changed, and are you able to get those students back in to get that hands-on training?
Yes, it has changed, and we're very happy about that, as the students are as well. They really wanted to get back, into the hospital settings. We saw, several months ago, maybe about 4 months ago, it's starting to ease up in some facilities, beginning to take students back in. And, each month it's getting more and more open for students to come back in. So I won't say we're quite there at full speed, but we're getting very, very close.
I want to ask you this too. Have you had to change your curriculum because of COVID? Did you have to put COVID into the teaching methods, whether it be the sanitizing methods or the way you're acting towards patients? Did that play a role as you're moving forward right now?
In all honesty, we always teach about infectious diseases. We always teach, about aseptic techniques. And that's been a standard in our curriculum. It probably just became a little bit more heightened, the aseptic technique in infectious diseases. In our simulation center, we're one of the very few simulation centers that has an isolation suite. So our students, when they went into simulation, actually had a real experience on how to care for a patient in an isolation setting.
Also, I've noticed over the past month or so that your students have been able to get out there and not only enhance their studies, get some experience, but also help the community with vaccinations. Maybe you can tell us about that, because you guys have been playing a big role in that.
My pleasure. We've been out and we have been able to do 7 different events where our students have administered the vaccine. And so we were requested initially by Congresswoman Sheila Jackson Lee to go out and to do some vaccinations, and it just kind of snowballed from there for us doing more. But it's a great opportunity for number one, for HCC and Coleman College to give back to the community. And number two, for our students to have an experience like that, an experience that they'll never have again in their life, to be able to give vaccines in such a setting. So I always feel that when our students get the opportunity to go out and do some public health and social service, it really enhances their education. It
also helps the community. I know your location, Coleman College, has been a vaccination site as well. Do you see more of those happening in the future? They're saying now that nearly half adults in America at least have received 1 dose of vaccination. Do you see you guys holding more events like this in the future?
Yeah, I think we will, Todd, as the need arises. We're there and open to be able to do that. So yeah, I think it's very, very probable.
We've been talking with Dr. Phillip Nicotera. He is the president of Coleman College of Health Sciences. We're talking about how COVID has affected not only our instruction, but really the medical industry itself. We're going to be returning. We're going to take a short break. When we return, we'll get a ground perspective from the boots on the ground at Coleman. We'll speak with one of the instructors, and Dr. Nicotera will return. We'll all be back right after this.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
Your blood pressure numbers could change your life. Lowering them could save you from having a stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
Now I'm, trying to get better, stronger than ever.
Natural disasters are a fact of life in the U.S. And between activities and school, chances are you won't be with your kids when they happen. Will they know what to do? Ready.gov/kids can help your children feel prepared, not scared. So talk with your family today.
Welcome to HTC.
Let me teach you. Let me help you get college credits.
Let me train you for a new career.
Let me change your life.
Come learn with us.
HCC, for everyone, anytime, anyway.
Welcome back to The Topic on HCC TV. I'm Todd Duplantis. We've got a great show. We're talking about how COVID has affected our instruction and the medical industry. More on that in a second, but if you're watching us on HCC TV, make sure you join us in social media. We're all across all social media platforms. You can find us under Houston Community College District. Most importantly, look for us on YouTube. You can subscribe to our channel, get notifications when shows like this are just posted. And if you want to download audio podcasts, we've got it all covered, hccs.edu/podcast. All right, back to the show. We want to welcome back Dr. Phillip Nicotera. He's the president of Coleman College of Health Sciences. And we're now joined by Dr. Patricia Pereira. She is an instructor in our medical assistant program. Good afternoon to you both. Dr. Pereira, I want to ask you how you've had to adjust your teaching techniques when you're instructing your students online. We had to start doing that a little over a year ago, and it's been going on a lot. How have you been dealing with it?
Thank you for having me here. This pandemic period has been really rough, but at the same time, different what most of the people seeing, I believe that it was a learning process for the students as well as the instructors and all the staff in ACC. We really have to make a lot of changes to make sure that the student gets involved in the class, and also trying to reach all the goals that we have in every courses. Every program did many changes. I'm going to, for example, give example for the medical assistant program where I represent. We have some online classes, and we have to face-to-face classes and last classes that we have to completely change. I'm going to give one example for pharmacology. We have to teach pharmacology and teach injections through the online versions. So we're trying to looking for and achieve and trying to innovate with safety kits that we have to show everything to the students. And when they came back in the summer, we really couldn't see that everything worked really fine. In some of the program, the most important that I believe that we learn is that we are using all the resources that we have in the forest. We didn't know that we have so many resources available, digital resources like the Canvas. Canvas has so many tools. Cisco WebEx, I can do group division of the group, breakout sections, and the student can see and feel that they are in the classroom with another classmate. So for the contrary, what the people seeing, I believe that has been an amazing experience for all the students and for the instructors too.
Dr. Nicotera, you know, back in March of 2020, we went away for spring break. We really never returned. And we went online almost immediately, but there was a lot going in the background. How hard was that, getting your faculty and staff ready to deliver instruction online, really within a matter of weeks?
I'm going to commend the faculty and staff. They embraced it immediately. Where you may think that it was be a little bit difficult, but they understood the importance of getting everything online and doing it as quickly as possible. And you know, sure, did we have some hiccups along the way when you try to do something new? We did, but it worked out really well. And as we went along, you know, faculty would let us know what resources they needed. And we were able to get resources very quickly. Certain programs that some of the textbook companies were coming out for simulation, and we were able to get them and implement them very quickly for our faculty to be able to use in an online format.
Dr. Pereira, what was the reaction from your students when we went online immediately? And was it a difficult curve for them, or were they more open to continue? Obviously, the end goal is to get finished with college and move into the professional world. What was their attitude when all this started?
I'm not going to deny that the students were really upset, and it was not just the student, the faculty, the staff, everybody. I believe that most of the faculty trying to get involved with the students, and we did so many techniques, we did games, we're trying to get the students and you know, let them know that we have the opportunity at least to use our digital resources to do the classes. So I believe that at the end of the period, still when they have some frustration, they understand all the learning process that we have. And when I can tell you what happened in the summer, when we finally brought the students into the lab again, and what is the value that they give now to the classes face to face. They are thankful because we have classes. And I can see the changes right now in the lab. I can see that the student has been giving more 100%. I can see that the students are trying to make sure that they understand what they do and they know what we have now. Yes. Has been a good and positive change, for sure.
Dr. Nicotera, for new students who are signing up to take classes at Coleman, are they more open to, because of COVID, are they more open to taking online instruction? And are they expecting a mixture of maybe both, some online and in person?
Todd, I would say they're expecting more of a mixture. When someone applies to our programs and wants to go into an allied health profession, they really are looking for that hands-on component. However, they do like the convenience of some of the class being online, so they don't have to always travel in. So I really think that the sweet spot, to speak here, is really the mixture of both.
And Dr. Pereira, do you agree that students now are going to want to have a mixture of both as well?
I believe that it's going to be a mix now. They have the advantage that they know now the resources that we have digital. So yeah, some of them can manage the schedule much better when we have hybrid schedule. And it's going to be much better also for the teacher. We now know how to use the resources. So it's going to give the opportunity to many professors to have many more courses, to the students to have more courses to manage the schedule much better. And I believe that we can lose that. We can lose the hybrid, that we need to be prepared for anything that happens now. We were forgetting about how to use our resources, and we were used to do the same. Right now, we are more creating, and we have to be innovating and trying to do new things for the students, and the students are more involved in the teaching process. So it's going to be more hybrid, but it's good.
I want to ask you both this next question. Dr. Nicotera, I'll start with you. How do you see the medical industry has changed because of COVID? Or is telemedicine going to be more of a thing than it ever was? And what do you see changing that we won't ever see again in hospitals?
That's a great question. I'm not sure I know all of the answers, Todd, but I do think that telemedicine definitely will be here to stay. I think just like we learned, in education that we can do some things online, I think we also learned in patient care that we can do some things online through telemedicine. I think we, overall as a nation, we will be more aware of infectious diseases. We always are in hospital environments. That's a very, very important part of managing a hospital environment is infectious diseases. I think, we'll be more protective of our employees, our healthcare workers and patients. Long term, I'm not sure there'll be any major changes in healthcare long term. I think we still need to see how we still have some time to see how this all plays out.
Yeah, we're not through with this yet. Yeah. Dr. Pereira, your thoughts on this?
I have one, that I believe that we learned something very important that we forgot long time ago. Is the role of the precaution and the prevention, like the most effective method to maintain a healthy community. So we all came to understand again that with the prevention and the education, we have the most valuable weapon to our health system. So we came back again to education, to prevention. We were used to, again, to do just treatment, treat patients. And this is not the base for the health community. The base for the health community, the best weapon, education and prevention. So we are the first step over there. We have a great step to do. We need to do that. We need to teach our students to do education and training to the patients.
Thank you both for being here on the show. When we come back, we're going to take a short break. When we come back, we'll meet with one of our HCC grads. He went to HCC a while back. Now he's a practicing doctor, and he's been doing telemedicine for quite some time. We'll hear from him how his industry has changed. More on the topic after this.
I know kids worry about a lot of things.
Getting enough food to eat shouldn't be one of them. Through a nationwide network of food banks, Feeding America serves virtually every community in the United States. See how you can help your community. Visit feedingamerica.org.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay. Just go to the site.
Roll over. When you adopt a shelter pet, you discover all the things that make them unique. And your mother. They're a little bit of a lot of things, but they're all pure love.
The faculty at HCC represents the best of the city. They're committed to getting our students to their goals. HCC, for everyone, anytime, anyway.
Welcome back to The Topic on HCC TV. I'm Todd Duplantis. We've been talking about how COVID has affected not only our instruction here at Houston Community College, but the medical industry as well. Right now, we've got a guest on our show who's normally a guest on our Up to the Minute. He does 2 segments a month about fitness and running. Dr. Christopher Segler, also known as Doc on the Run. He joins us now, and also former HCC grad. Good to see you again, Dr. Segler.
Hey, thanks for having me here.
Hey, I want to ask you first off, when you went to HCC a while back, do you think you could have done this online instruction when we went online? What were your thoughts when you saw all that happening, especially to college students?
Well, I mean, I think so. You know, that's the thing is I remember I spent a great deal of time in traffic just commuting to school. So I would not have really been opposed, I think, to having some days a week where there was some remote instruction. I mean, it's great to be in class with the milieu of the students and the instructors, but at the same time, and you know, for many commuting students, Houston's a big area. So depending upon which campus you might go to, it could be a long time in traffic. And I certainly would have found that useful, I think.
Let's talk about telemedicine, because long before COVID, you were practicing telemedicine with your patients. Now, you're a doctor of podiatry, and you also treat a lot of sports industries, and you are a concierge doctor where you would go to your patients. Maybe you can tell us about how you first started doing with telemedicine. What was the reaction when you first started with this?
Yeah, sure. So, you know, I've been doing house calls and telemedicine for 10 years or more. And I even wrote a book on doing house calls for other doctors who, interestingly, don't seem to know how to do that. But the fact is 100 years ago, everybody did it that way. It's just that, you know, instead of driving a car, you'd ride a horse. It's a pretty simple model. And, you know, now I get paid with a credit card or a check or something instead of a carton of eggs or, you know, a chicken. But that's really the only difference. And, you know, and much like your point with the students, the reality is that although, you know, we like to go to these places and we're used to going to classes and to work and to doctor's visits, the fact is that a telemedicine visit is a lot faster and a lot more convenient both for the patient and for the doctor in many circumstances.
Are you finding that patients now are more open to maybe doing a Zoom call with you or something online than they were a year or so ago?
Yeah, so this is a really interesting thing. I actually had some reviews many years ago where people actually posted reviews and they would say, well, this guy is like some kind of internet doctor or something. And I didn't know if he was even like a real doctor because it was so foreign then. And even with house calls, people would ask me, they say, so you're going to come to my house, or did you go to, are you like a real licensed doctor and stuff? Because it was so foreign, but now it's obviously commonplace, and this has become very commonplace because of all the restrictions with social distancing as we went into the pandemic.
I know in your practice, you're in the San Francisco area, and you did a lot of concierge calls to your patients before COVID hit. Let's talk about when COVID hit, because that pretty much shut you down from going into people's homes. And are you able to get back into that now?
Yeah, but you know, having the capacity to do house calls actually changes things considerably. I mean, think about this for just a second. Think about the last doctor's office you were actually in physically. There is no way in a normal doctor's office in a treatment room that is basically has enough room for a chair and a stool for the doctor to sit on. There isn't 6 feet from one corner to the other. So you couldn't possibly be social distance 6 feet.
Yeah.
But even early in the pandemic, I would wear a mask, a double mask with a, N95 mask, a face shield. And I would meet patients many times outside on their patio, sometimes by their swimming pool, sometimes in their garage with the door open. And although that's not conventional, it's certainly much safer than meeting in a very, very small treatment room. And if you see patients in the office exclusively, that makes that impossible.
Has your calls for telemedicine gone up recently, or are you finding that more patients still want you to come see them at their home?
It depends on the circumstances. So, obviously, if you have to have a procedure or something like that, you have to have an in-person visit. But if it's for advice, if you are trying to figure out how to run with a stress fracture, well, that certainly can be done just as effectively and a lot more efficiently through a telemedicine visit. But, I really started doing telemedicine, not really in the sense that you think of conventionally, but just as a way to make things more convenient for patients when I did house calls. And how that actually started was the simplest thing that we do as foot and ankle surgeons, which is an ingrown toenail.
Yeah.
I mean, it doesn't get any simpler than that. But if you think about the way that goes in a conventional setting, when I had a normal practice, the routine went basically like this. Your kid gets an ingrown toenail, you take time off of work, you take him out of school, you bring him in the office, we look at it, we say, okay, we have to fix it. We make the toe numb, we remove a portion of the nail, it's fixed, we put a bandage on it, we send you home and say, remove the bandage, put a Band-Aid on it, keep a Band-Aid on it over the next week, and then come back and we'll check it. So every single time at those follow-up visits, what would happen is that the parent would take time off of work, they take the kid out of school, they bring him in the office, they would have to take half a day away from school and work, and I would literally walk into the room and look at it and go, yep, looks great, have a good day.
Yeah.
And you just wasted half a day of people's time. And, if you're in Houston and you run a small business, if you are self-employed, you're not going to get paid time off for that kind of stuff. And so in those circumstances, I would say, well, normally I'd have you come into the office, but I'm not going to make you pay for a house call. So just take a picture of it, send it to me. We'll talk about it on the phone. And in 2 minutes, you'll be done. And I don't have to drive in traffic, and neither does the patient. And so I think for those circumstances, these patients who have been now exposed to telemedicine, maybe involuntarily, frankly, because their doctor couldn't see them in person, they're going to be a lot more apt to use it. Just like Dr. Nicotera was talking about, this idea of being exposed to some new thing. Like when I was in college, I didn't buy anything online, nothing. Yeah. Well, now I buy almost everything online. And so these changes are just bound to happen. I think Dr. Nicotera is right about that.
You mentioned ingrown toenails. People may be wondering, well, what can you treat through looking at a Zoom call? You mentioned ingrown toenails and stress fractures. What other things can you diagnose or help a patient with through a Zoom call?
Well, think about all of the little things that come up for you where you think, if you had a friend that was a doctor, you would say, hey, could you just take a look at this real quick? And these are things like rashes, something that you may think is early skin cancer, like Dr. Pereira was talking about the importance of prevention in healthcare. And telemedicine is perfect for that, because if you have something where you think, okay, is that a bruise that's going to is that a problem or is it not a problem? Do I really need to seek medical attention for this? And sort of that early prevention and triage kind of routine where you're trying to figure out, is this something I really need to see a doctor for, or is this something I can really not worry about? And those things I think are really big. So if you just think about the simple things like, do I really have a bad sore throat? Do I need to go into the doctor or not? I think all of those kinds of things are going to be really easy to address through telemedicine in a way that's just infinitely more efficient.
Right. He's Dr. Christopher Segler. He's known as the Doc on the Run. Of course, where can folks, I know you've got a podcast, you've got a website, you treat people online. What's your website?
Yep, docontherun.com. In fact, if you want to make your telemedicine visit more efficient, I actually created a thing a long time ago for people who are going to have visits with doctors. It's just a list of questions, 10 questions to ask the doctor so you can get your doctor to focus on the solution rather than letting the doctor direct the question and you leave it not knowing what the real answers are. And that you can get going to docontherun.com/questions. It's free. You can just print it out. And if you're not a runner, you can still modify it for your next telemedicine visit so you can really focus on the goal rather than focusing on the problem.
Dr. Christopher Segler, thanks for being here on the show.
All right. Thanks for having me.
All right. And thank you for being here on the show today. I'm Todd Duplantis. I'll see you next week on the topic.